Okay, we'll call the Health and Human Services Committee meeting to order. We have a packed agenda, so I'm going to ask department heads to be concise and our members to be concise as well. The first order of business is to accept the minutes from the November 29th, 2023 meeting. Second, all those in favor? Aye. Opposed? Motion passes. Okay, next we have public health. Gina?
Good morning, everyone.
Good morning.
First thing I have on the agenda are quite a few resolution requests to move money. We have certain grants that carry over into the next year. So we're looking to move those remaining funds over into the 2024 budget. I have 7 different grants. I can just kind of run down through those. I don't know if we want to do one at a time resolution or request, or do we do them all at once?
Why don't you run down them? And
Okay.
if there's any questions on any single one?
Okay, all right. We have the COVID-19 vaccine response grant for $70,772. Then we have the unspent public health fellowship grant, and that is the remaining balance on that is $776,243. We have the child passenger safety grant, and the remaining unspent dollars is $13,200. We have the public health preparedness grant. The remaining balance there is $42,351. And we have the epidemiology and laboratory COVID-19 grant, and the remaining balance there is $802,931. And we have the early intervention administrative grant, and that the remaining balance is $8,699. And then we have the public health infrastructure grant, and the remaining balance there is $561,168. So those would be all different time periods. Some of them would span over several years. So just I'll request to move that money into the 2024 budget.
Make a motion to send it to finance.
Okay, make a motion on finance, second. Tina?
Thank you.
Any discussion? All those in favor?
Aye.
Chairman, can I ask about one?
Sure.
It won't change the resolution.
Okay.
Either the infrastructure one. You got $561,000 to go forward. The resolution to recognize it last year was only for 113.
Right. Last year, they only allotted us the first year amount. And now they've released the full 4-year amount. So they want us to budget for the full 4 years.
Okay, and you've got the 121 account, $385,000. We're not gonna amend the 121. Right, because it's for salaries that are already budgeted.
Right. Well, I have another part of my agenda that relates to that, requesting positions. So it would be additional money that's not budgeted yet in the point ones.
I won't tie up the committee, but we may need to talk before finance, that's all.
Okay. Yep.
Next item.
The next item actually relates to that, the grant that Al was just mentioning. The public health, we'd like to request 2 public health specialist positions. We had talked about this during the 2024 budget process, and they were put to the side until the funding was going to be pulled over into the 2024 budget. So there are 2 public health specialist positions, and really what they would be doing is replacing what we already have in our budget for fellowship positions. The fellowship program with New York State is going to be ending June 30th, the way that it is set up now. So we'd like to request those public health specialist positions to be able to carry over those positions, and it would still be 100% funded through this public health infrastructure grant. So those positions would start end at the very last pay period in June, and the fellowship positions have to be ended by June 30th. So we are looking to create those positions. And again, that was something that was discussed in the 2024 budget process. They were, the funding just wasn't there yet in the budget. So looking to create those positions and remove the fellowship positions from the staffing pattern effective July 1st.
Okay, second? Eight? Okay, all those in favor? Aye. Opposed? Motion passes.
That's moving into personnel.
Yes.
Thank you.
I don't remember that.
The next item is the request to have an intern within our department. She is a student at SUNY Polytechnic Institute. She is a RN working on her BSN. She is local to the area. She's from Granville. So we're looking to have her start with our agency as an unpaid position, and she'll be, like I said, working on different projects within the office to complete her RN to BSN to grade.
You know how long will the internship be?
It'll be for the spring semester, so it'll go through May.
I believe it's 60 hours.
60.
June? Okay, second.
Thank you.
Yeah. We need to focus on personnel.
Not for the intern, it won't change, the staffing pattern or anything, but you should probably have a conversation with the personnel officer.
Yep, I
It's
did.
probably parts of
Yep.
orientation.
Yep, I talked to her yesterday.
Perfect.
Yeah, thank you.
Sure, I just have a question.
Sure.
The, excuse me, the, being a volunteer, how does that affect any of the ethical requirements, that type of stuff?
We still have to go through all those trainings. They have to in order to access patient information. So that we do have a set criteria that they have to follow. They have to be up to date on all the vaccines that are required with our agency, as well as the trainings.
So it'll be all covered? Got it, okay, thank you.
Any other discussion? All those in favor? Aye. Opposed? Motion passes. Yes.
The next item, I have two overnight authorization requests. One is in Pearl River, New York, and that's from 2/27 to 2/28. In February, it would be one of our health educators and one of our graduate fellow. It's called Project First Line. It is, NYSHO is paying for the conference and the accommodations. So the only expenses we would really have would be mileage, and getting there and getting back, and meals while they're there. So it comes out to about $274. But that expense can then be covered under a different grant, that we have. So it would really be 100% covered. So just looking for permission to move forward on that overnight, for those two.
Any second? All those in favor?
Aye.
And then the second one is for Elisa Arlen. This is for the 2024 Public Health Partnership Conference. It's in Saratoga this year. It's from May 1st to May 3rd. And there are evening activities that go on there. And again, this one is also paid for by NYSHO, the conference and the accommodations. So it would really just be, I think, 3 meals altogether. And again, that would be covered under other funding as well.
Motion second, Sam. All those in favor?
Aye.
And then the next thing I have, we have to, at times, bill insurance and bill patients for vaccines. Most of our vaccines are provided to us or from the state through our Vaccine for Adult program and Vaccine for Children program. But then there are times when we have to provide private vaccines. When we do that, we have to maximize our reimbursement in order to be able to then claim the remaining expense on state aid. So it's time for us to update our vaccine fee schedule. Again, this is not to make a profit. These charges are strictly just based on the cost that we would have to pay for the vaccines. So I just wanted to update that schedule with you all, and I don't know if that has to go for resolution. To update the fee schedule? Okay, so I don't know if you all want to take a look. I have some copies here. I didn't make a lot of copies. But that's just the charges that we would have per vaccine. And then we also do charge on top of the vaccine, we charge an administrative fee. And again, we do bill insurance when we can. And we also offer a sliding fee for those that are unable to pay.
Is this a year?
We try to do it yearly, yes. I will admit in the past few years, because of everything going on with COVID, we weren't really giving a whole lot of other vaccines, other than COVID. So this is the first time we've updated it, in several years. Just looking for a,
Any discussion? A motion to approve. Sam? All those in favor? Aye. Opposed? Motion passes.
Thank you. And then I just have a couple of program updates. I wanted to update you on our move. I think Matt Jones had also mentioned it in government ops. I have reached out to the state health department, and right now they are telling me that it's still under review. They have had quite a few questions, and we've responded to all of their questions. So they have all the information they need from us. So now we're just kind of waiting on their final approval before we can move forward with that process. So I just wanted to give you a quick update there on that. The next thing I wanted to, quarterly, we have a Healthy Community Coalition call, and it was brought up on the call. We do program updates with some of our community-based organizations. The Adirondack Health Institute, they have a opioid harm reduction program as well. And they did mention that they did receive approval through one of their grants to put a harm reduction vending machine within our county. So we don't have an exact location on that yet, but once I find out, I'll definitely share that information. So that vending machine would be located in a 24/7 location. And it would have Narcan available, test strips available, feminine hygiene products, things along those lines. So I just want to make sure you were all aware that that was something that was moving forward within the county.
So I guess I would have to ask that when you kind of have an idea of a location, that obviously we don't have many 24/7 areas.
Right.
And we have very limited space
Mhm.
where people would be able to access
Right.
that kind of machine.
Mhm.
So I don't, yeah, we could have discussion
Yeah.
beforehand.
Yeah, that was the first I had heard of it, when I was on that call, with HI. So I've been in further contact with them to see if there's been any movement on where the location would be, just so we can all kind of be in the loop on where that is. And I have spoken with public safety and the sheriff's office about that as well, just to give them a heads up, that it's gonna be somewhere. I just don't know where yet.
I'm assuming that's up to the county, right? It's not something that has to be here. It's something that we're gonna accept or not accept.
I think it would be either looking at a, private location. So I don't know what the rules are on that as far as, is I think they're looking at like libraries and things like that. So I don't know what the county, what their role would be in approving that. I'm not sure.
So,
Does the vending machine need heat?
It needs to be climate controlled. Yeah, so there needs to be the way they explained it to me, it needs to be under some sort of outdoor overhang.
Okay.
But it can be outside, covering it, and it does need an outlet, to keep it climate controlled.
So the machine could be kind of controlled within itself.
Exactly. Right. Yeah, so I will definitely keep you all updated on that once we know of a location, or I can involve you in the conversation
I
as well.
think I may have misunderstood. So it's somewhere in Washington County. It's not.
Not
at
in,
Washington.
right, not on our property, yeah,
All right.
right, not on the county property, right,
Thank you.
yep, sure. Next thing. Oh, I don't know if you all saw, but our rabies clinic was released, for our rabies vaccines. Our first one's gonna be in March. It is on our website. And we do have certain sign-up dates for each clinic. So we'll get that out as well. If you wanna post that in your towns, we can send that out, so people are aware of when those clinics are gonna be happening. And that first one's gonna be in Whitehall, March 23rd, I believe. And then I have some great news. The early intervention program, was audited by, their respective department at the state level. And they came in, I think it was a couple weeks ago, and they were very impressed with the organization, the work that our staff is doing. And they were unable to find one finding, which is quite amazing for a review from the state. So I was pretty proud of them and they did a great job. I just want to pass that along. And then, I do have one handout. I know we have some new people, so I just wanted, I'm not gonna spend time going through it. But I do have, it's just a public health program overview document. So, and again, we have a lot of information on our website as well. The annual reports are out there, our executive summary. So you can always go there as well, or you can call, stop in. Our doors, well, they're not open, but you can call when you get there and somebody can let you in. But anyway, these are some handouts in case anybody wants one. And again, if you have any further questions or you want to meet with me, just give me a call. And I think that's all I have.
Great, thank you, Tina.
Thank you.
Next up, we have the Department of Social Services, Janet.
Feeling the pressure,
Yeah.
that concise that. See.
Hi, Mary.
I did want to start out with introducing myself, but I do believe that everybody here does know who I am. I've had the pleasure of having a conversation with our visit supervisor. And I think I've met you before. Okay. So moving on from that, I wanted to just cover some of the different contract related issues that have, changes that have come up over the last couple of months that do have impact on our budget. So some of these are small amounts of money and some of them are larger, but just to roll through. We have a contract with Dr. Myers, which Dan would be familiar with. It is it's been a very unique contract in itself. We are the only agency that he carried a contract with, and it was his sole purpose for carrying his insurance coverage. He has let me know that he would like to end that contract at the end of his year of insurance. So it has been only about 3 hours a month, $130 an hour. So we're looking at from May to December that it would be a change, a reduction in cost for us of $3,120. However, that's truly not nearly what the impact will be to us. The service that he is providing is invaluable. There isn't any replacement for it in our area. It's been, he will specifically work with children that have been in foster care for lengthy periods of time and look at their bonds with their families, their bonds with the siblings themselves, and give us guidance on what we should do moving forward for permanency. So that will be a loss for us. We also had a contract with LEAP for the last few years to work with DSS clients that we refer to them, that we view as being eligible for Social Security. The paperwork process on applying for Social Security, even getting it reestablished when they've had benefits in the past, can be lengthy. And so LEAP had provided that service for us. LEAP has been fantastic in providing that service for us. But we were made aware that SAIL, Southern Adirondack Independent Living Center, also offers the service to the public and has a reasonable rate of success. We've talked to them individually. I know that there had been some outreach to Melissa from SAIL also, and looking at widening out with the business that they're in the county. So this is one of the areas that we will be increasing our usage of service through them. That will be a cost avoidance for the county or for the department of $27,500 is what we contracted with LEAP for. BHSN, which is Behavioral Health Services North, that is the company that filled the gap when Glens Falls Hospital pulled out of behavioral health services. We have two separate contracts with them. One is for a KSAC, doing screenings for TA applicants, people that come to us that we believe have some sort of a issue with substance abuse that prevents them from working. We would have that person screen them and then assist them with referrals. Sometimes it's getting them into inpatient care, that sort of thing. Other times it could be just following up on whether they're actively engaged in their treatment. We have another one that is for a plan of safe care. That is something that's in the world of Child Protective Services, where they would go out with a caseworker to be able to work with young parents of young children, children sometimes that have been born positive toxicity levels. So with the changes in law, the situation with the legalization of marijuana, some of the changes in our regulations with having people seen in our office, we found that the volume of requests for their services had reduced. And it was timing with them having turnover in one of their positions, so we are combining the two contracts. That'll be a cost avoidance of $72,000. Safe Harbor, that's the name for the work that's related to human trafficking. This is the contract. Well, DSS is required to perform risk assessments on every child that we work with through our services area and document it in our record keeping system. Funding originally came through Youth Bureau, I believe, right back when it initiated. It started with some training. And then we picked up with increasingly more funds through the next couple of years. And then we knew that there was going to be a decline following that. So at this point, moving into this year, we have been notified that our funding's been reduced by $13,000. Sue and I have talked about that, and we think that we are okay and able to absorb that hit. So the last of the things is a Berkshire Stepping Stones contract. So through Berkshire Farms, we had a separate contract for intensive preventive services. This was for older youth that were either facing persons in need of supervision, charges, or JD behaviors. And it was about preventing their placement in foster care. They provided a very intensive work in the homes with the families and had a very small caseload when they would do that. They have also had a lot of turnover in their positions. Between that, the difficulty in keeping those positions filled and it being unsustainable for them with us, the county, trying to hold them at less than 3% increases each year, they canceled our contract at the end of last year. That contract was budgeted for $94,161. That is going to be also another impact for us, but I think it's an area, unlike with Dr. Myers, an area that we are able to sort of try to bridge the gap with. Again, I've met with and Sean from the Youth Bureau, and we are going to be looking to increase the utilization of the services that we already have through our STSJP funding that comes to social services, and we contract for an array of services with Youth Bureau. And I'm looking at this point to see what other programs, other counties in the area are using. So I may be able to look at something else or developing something new. And I'll share more information on that when I can. Any questions on any of those areas? Okay, budget amendments. I believe that there are some resolutions in your packet. I am not sure which order they're in, however. So what's the first one? Or if you want to, I could just drive the bus. Transferring the ARPA funds. We have two different resolutions for transferring ARPA funds. This is the ARPA money that the county dedicated towards foster care recruitment and expansion of daycare services. So one of the resolutions is to move what remains in the balances right now, the unspent funds, once we pay out the other things that we have. I do have an amendment to make to the copy that's in your file, though. I was asking to transfer $187,933. We have a voucher that's out there for $135.44 right now, so we'd like to amend that number to $176,796. $176,796. And also another portion of the same resolution is to move the 11,160 that remains in the childcare allocation or appropriation forward to the 24. So it's moving from 23 to 24.
Motion.
Second, David. Any discussion? All those in favor?
Aye.
Thank you. I think that's understood.
Helps to say, because it's minutes.
Who's the finance?
The other one for the ARPA funds is to move into our personnel lines. One is into the DSS regular personnel and the other is into the overtime 1.5. And so we would be taking $11,935 from that, the funds that are still there from 23 and moving them into 2024, dividing that between regular earnings and overtime to pay for our staff in the time that they are doing training for new foster parents and recruit activities for new foster parents.
Motion to move to finance.
Second to move to finance.
There you go, any discussion? All those in favor? Aye. Thank you. Motion passes.
And I have one remaining resolution. This one is very good news. We had previously received ARPA funding that was dedicated to adult protective services type related services funding. We had received two different pots in the past. One was 13,000 in 2022. One was 25,000 in 2023. We had spent those funds and were advised that if we wanted to request more, there would be funding available that was unspent through other counties. So we did request, we shot high for what would be the cost for the 5. We have contracts for 5 beds for transitioning from homelessness into self-sustainability with 2 of the shelters in our area. And for a full year of all 5 beds, it was $151,520. And that's what they awarded us.
Ah,
So,
Congratulations.
thank you. Gina thinks so, yeah, that's great.
Well,
So I do need a resolution to acknowledge that and put that into our record.
Motion by second. All those in favor?
aye.
Thank you. Keeping an eye on them over there, Al.
Also had to define it.
Okay,
Getting to finance.
all right. And then I have a request for a staffing pattern change. I would like to reduce 1 social services examiner grade 10 and increase by 1 clerk grade 7 in my staffing pattern for the year. We have had a couple of vacancies in social services examiners that we just continue filling our positions, but there's consistently been 2 that we've had set aside in sort of a holding pattern. And what we really need more assistance with right now is clerical functions.
That'll be going to personnel.
If it gets moved, I guess.
Okay, motion to move to personnel. Second. Nate,
Thank you. I had already
all those in
discussed that.
favor? Aye.
I had already discussed that with Danielle as well. Just wanted to share with you that I have been appointed to the NISAC Standing Committee on Medicaid and Human Services. This is something that there has consistently been 2 social services commissioners within the state that have been appointed to that NISAC committee. One of them recently retired. So I will be attending the first committee meeting or my first committee meeting on February 26th at the start of the NISAC conference. That will just be going to that, it's in Albany. I'll just be driving down for that meeting, driving back.
Congratulations.
Thank you. And I attended my own Public Welfare Association conference last week. So I do have a few things to share with you. None of these, some of them are gonna, I'm sure, pass through, but I always overreact to what is proposed in the executive budget, and then often it gets changed, sometimes for the better, sometimes for the worse. So there's a great deal of ambiguity in what is right now proposed and the information that we have available about it. Something that has been coming to us over time with some federal legislation and rules that have changed related to Families First, which I've talked about in the past in the scope of foster care impact. The end result of that is supposed to be an increase in federal funding for preventive services. We have not yet received the approval from the feds to be able to draw that down, however, so we're still waiting on that. That should then provide more federal funding, which would reduce the amount of the 68-32 split preventive services funding that we use at this time through the state. I asked if they are making any plans of changing the fact that that 68-32 is currently uncapped, and that isn't something that had been on anybody's radar yet, so hopefully it won't be any sort of a major change at this time. In the world of temporary assistance, the first time that the state has actually acknowledged that the caseload size is increasing of the safety net eligible population. So safety net and TANF are two categories of temporary assistance, which is the cash money that is provided to people who are income eligible for assistance with their cost of living, their personal hygiene products, and to offset some portion of rent. Safety net is the type that is only available to people that have exceeded their 60 months of TANF funding, and that population has been growing in Washington County. We have more people that are safety net because they have exceeded that. Safety net is also for people that are single adults without children in their custody. And that is a 79% share to the county. So the state has finally acknowledged that the size is increasing. They've in the past denied that because they previously said that once it did start to exceed TANF, they would rework the funding with us, but they have yet to do that. But they've increased their part of the budget on it. So since they only pay 21%, the fact that they are increasing their budget on it, I think is a serious acknowledgement from them, but we still haven't gotten back to what had previously been 50-50 share of the cost. Flexible Fund for Family Services is showing a different breakout this year. That has been flat for the last several years. That is, I think, around a $2 million pot that is provided to DSS, and we fund several contracts as well as some of our own staff through that. They have increased the threshold that must transfer from within that funds towards child welfare. And in the short term, they're saying that they are offsetting that by increasing the funding by $50 million. That math works out for the first year, but without that increase in the next year, it is just kicking the can down the road. But at this point, I'm not able to say what the actual impact is to us. There's a new program that's proposed in the executive budget that would apply $17.2 million to provide case management to support wraparound services to income eligible households. So again, I would imagine that being the people that are applying to us for temporary assistance. We already have a build-in for that within our department through the support of the board in the past when we have built a unit called Hope that also provides some level of case management services to people that are homeless. So potentially, this would be other funding that we could draw down to pay those salaries. Potentially, it could come through with qualifications that exceed the level of what we are using currently in that. Currently, we have caseworker assistants, which could be, I know they can have an associate's degree. There may be some ability to combine experience with a high school degree, but I don't know that for sure. But I know that it's not requiring a 4-year degree. It could come from the state telling us that it needs to be a 4-year degree or a master's level. So time will tell. Also from NYPWA, I have been appointed as the treasurer again. That is a position that I held prior to going through the chairs for the presidency. It's really just that I've stuck around as long as I have, and my name is on the reports. So they put me back in as treasurer for the time being. That being said, though, the Board of Directors Strategic Planning meeting is scheduled for February 28th and 29th. The 28th is when we would have Health and Human Services. So unless there's something excruciatingly horrible that I need to come to the committee with, I'll plan to miss that meeting. And the last two quick things, we've convened a small work group within social services to look at developing a new performance evaluation. That's something that I had talked with Melissa about in the past. We just dragged our feet on it and haven't pulled together a work group. We now have one. The current model that we have is pretty lengthy and it's used for all probationary employees as well as employees that have been in their titles for a long period of time, and it's very cumbersome to complete those evaluations, which often mean that we're very delayed in getting those evaluations done. So we'd like to look at something new, a new format. When we have that, I will be bringing it to Melissa and probably to Danielle also, whatever you recommend at that time for a review. We also have convened a work group to review and update the agency mission, values, and goals. This was one of the areas that I would have shared in the past when the pandemic hit. So many initiatives changed that it really seemed to be quite a diversion from what our mission had been, which was to support self-sufficiency. It really seemed to a lot of our workers that the direction that regulations had taken were more about handholding and supporting as opposed to encouraging them to be self-supporting. There is truth to that. And we're going to be taking a look at where we're currently at with regulations and what guides us as we're doing our jobs and coming up with an updated version, which I can share also in that. So,
Thank you, Tim. Hey, Gina.
Morning. So I'm gonna try to be very concise. But to prepare for my several talking points today, I did develop a written document that I'm gonna read around. So I hit all the major points. For those of you that I believe I know everybody here, but my name is Gina Panchinichi Mitchell. I'm the director for Washington County's Office for Aging and Disabilities Resource Center. And I've had the pleasure of serving this position for the past 12 years. So I'd like to share with you that our office is very unique in that Office for Aging has an MOU with the Department of Social Services. And the reason for the implementation of the MOU is to implement our New York Connects No Wrong Door system. So this gives our department an additional name of the Aging and Disability Resource Center, known as the acronym ADRC. So to clarify, it can get confusing to folks because they hear us refer to as Office for Aging or Aging and Disability Resource Center or ADRC. So I just wanted to give a little bit of an explanation about that at this time. So this partnership has truly created an environment where DSS and OFA staff are co-located to include our fiscal team and a shared budget and certain appropriation lines. The DSS commissioner and I work very closely to ensure our staff are fully supported in their diverse roles so that our Washington County residents receive the best possible services. Today, I would like to share with you our one-page flyer. Heavy one. This one-page flyer gives a very brief summary of the services that our department offers. I'd like to share with you that our services are reimbursed through at least 15 state and federal funding streams, and each of those 15 funding streams has a very specific funding criteria attached to it. So at a future annual report presentation, I will go into more detail about what these services are. In the interim, you're welcome to utilize this one-page flyer to check out our website, to look at our past annual reports that truly give a picture of what we offer. And most certainly you can reach out to me with any questions, use us as a resource for your constituents. And if you'd like to have a tour of our department, you're welcome to do that. On the back side of the flyer are, this is a flyer that we do hand out and distribute to the public. So on the back is a list of resources that we've compiled with contact information. Any questions? Sure.
So what you're saying that, EP in the systems, is that just for the fuel, would that include if they needed windows or repairs?
So the heat's the energy heating component, so all modification in the window piece would be a separate
Fall under one,
resource, yeah.
that's all you're saying.
I'm sorry,
Does that fall under your saying?
call our office and we will most certainly provide the information. And the reason why I say that is we used to have, there used to be a program through Homefront, which is now through Ticonderoga Pride,
Right, yes.
Pride of Ty, that will assist income eligible individuals with, home repairs modifications and such like windows.
I had a question, I just wanted to ask you.
Gina, I have a
Always call
question
us.
on the phone numbers, food pantries, I don't see comfort food. Is a food pantry,
I'm surprised it's not on there.
yes, and do.
Thank you for that observation.
You say comfort.
Comfort Foods, yeah, which is, it's an organization in Greenwich, and we work very closely with them. They are an organization that helps us with our farmers market coupons for individuals over the age of 60. Let me know if you see anything else that's pertinent to that document, and we can most certainly adjust it. Thank you. Any other questions? At the last committee meeting, I spoke about the implementation of a new service called Blooming Health. This is a fully funded initiative by the state, and it provides local districts with a white labeled communication platform. Meaning is a software service product that allows agencies to rate their own branded version of messaging. This service allows us to send alerts, announcements, and surveys, and we can do things like appointment reminders to our program recipients through phone calls, text messages, or emails. To implement this service, at our last committee meeting, we agreed to receive written or verbal consents from program recipients. We did this and we sent out approximately 400 written consents and we received about 82 back. And speaking with Blooming Health about our low turnout rate, they shared that the only information they need from our consumers is truly their name, their telephone number, and the program that they're engaged in. Because we had such a low turnout rate for our paper consents, they suggested that we engage in a self opt-out or unsubscribing process. Because we already have client consent to reach out to them and deliver our service via text or voice calls, we can engage in an opt-out consent process to inform older adults about the new communication system we're adopting. This can be accomplished by sending out a welcome message from Blooming Health that includes clear instructions for an individual as to how they can self-opt-out or unsubscribe from the program. With the low turnout rate of the paper consents, I would like to ask the committee's approval to engage in the recommendation made by Blooming Health for a welcome message to be sent out to Blooming Health, through Blooming Health, that includes directions for individuals on how they can self-opt-out of the service or unsubscribe from the service.
That makes a motion. Second, okay, discussion, okay, okay. All those in favor?
Aye.
Opposed? Motion passes.
Thank you. My next item on the agenda is the Office for Aging Advisory Council appointments. So thank you to everyone who's assisted our department with the appointment of the advisory council members. Advisory council members are truly the eyes and the ears at the community level, and their feedback truly helps myself and my department in the development of our annual state plan. At this time, I would like to request a resolution to appoint the following individuals. Would you like me to read through? So I have Sandra Lumpkin from Argyle, Gretchen Stark from Fort Anne, Jeannie Mullen from Fort Edward, Val Baez from Granville, Gerald Belch from Greenwich, Renee Roundtree from Hampton, Michelle Louis from Hebron, Quimby Mahoney from Jackson, Debbie Mumlo from Kingsbury, Dolores Mullen representing White Creek, Antonia Estrada appointed as an at-large member. We also have Washington County departments participating, and we have on behalf of Commissioner DeLorme, Jody Smith being appointed, Max McDonald from the Community Organization Designee, Kristen Hardy from the Washington County Sheriff's Department, and Tina McDougal from Washington County's Public Health.
Motion, please. Second. All those in favor? Aye. Opposed? Motion passes.
Thank you.
Thank you.
I'm pretty good with concise.
Yes.
Document to share for the next agenda item.
God bless you. Sit. That's it.
I'm sharing with everyone two items. One is the proposed executive budget for aging programs. And the other document is a advocacy letter developed by our Association on Aging in New York. So kind of follow suit along with Commissioner DeLorme. Sometimes I may overreact when the proposed budget is released. So at this time, I definitely would like to share with you some facts and have you sift through what's being presented. So as you may be aware, the governor has released the New York State's proposed executive budget. The sheet I'm sharing with you today is in regards to aging programs and was developed by our Association on Aging in New York. I'd like to bring to your attention that the proposed budget for aging programs is flat. So as you can see on the document, there are some areas that were decreased. And just to provide clarity on some of those areas, I can share with you that the NORC, it's called NORC, which stands for Naturally Occurring Retirement Community. It is a community or neighborhood with a growing population of older adults. And I can share with you that right now NORCs exist primarily in New York City, so that doesn't have a dramatic effect on us. But as you can see, there was a $1 million cut in the proposed budget. Lower down, you'll see that Lifespan also received a reduction. And Lifespan is an agency located in the Rochester area and provides elder abuse education, outreach, and they actually serve all of New York State. This area, as you can see, was decreased by $375,000. Lower on this sheet is the statewide senior action. And this is an advocacy council that provides New York State residents with Medicare, Medicare fraud, and patients' rights helplines. They're also showing a decrease by $200,000. The Holocaust Survivors Initiative was fairly new in the last budget year. And I don't have any details on that. I did seek out to try to find out about that initiative. And I honestly have nothing to offer. But most certainly you can see here that there was a decrease in funding. I spoke at a previous committee meeting about the Master Plan on Aging Initiative, also known as the MPA. The MPA is an executive order by the governor's office for the Department of Health and New York State Office for Aging, along with several agencies and organizations across New York State to come together to develop a plan that guides the governor's future budget on aging programs. It's been unclear why there is a $1 million allocation to this or how the funds could be spent. So in summary, the presentation of the proposed flat budget for funding like CSE, which is our Community Services for the Elderly, ISEP, which stands for Elderly Initiative Services Educational Program, Wellness and Nutrition is WIN, Senior Transportation, Social Adult Safe Services, Caregiver Respite and CSI, which is our Congregate Services Initiative. The flat budget does not support individuals to age in their homes nor in their communities. Several counties across New York are experiencing wait lists in many areas to include non-Medicaid in-home services due to the lack of funding that can go towards in-home personal care services and also salaries of home care aides, which there's a great shortage of. So at this time, I received a draft letter from the Association on Aging, which I did share with you today. And it kind of highlights the impact of the budget on individuals and the impact that it has to allow individuals to age with dignity and independence within their homes and in their community. So at this time, I would like to seek some guidance on this letter. I have prepared it under my name as though it could be sent, but most certainly I would like to have the committee's approval to move forward with submitting this letter. And if it is something that's supported, I can most certainly draft this letter or present it so individuals can also submit the same letter to the governor's office.
Let's say that. Discussion, question. We have the idea over last year, how much our aging population has increased or decreased this year?
I do keep data on that. I have that already in my annual report, but I can't tell you off the top of my head right now. And I feel like I'm not going to speak to it because I'm afraid that I'll misguide or provide some misinformation.
If that's advantageous to us as a county because the numbers have increased, would that be because I know it's addressed a lot of the overflow, so we specifically show our need for more because our population aging has increased, that you may want to add to it. Just a thought.
You're on the same page. And actually, I received this 10 minutes before committee today and kind of made some additions to it myself. But having it be focused more towards Washington County and the statistics absolutely makes sense.
Just a thought.
So we're voting to approve, should be creating this. Yes. Oh, so sorry.
Between it, creating a rural county, doing the PACE program where people can go in and use daycare so that people continue to work. Could be really helpful. Is that included in this?
So PACE is under the premise of Medicaid and funding and individuals and supported through the Medicaid Department of Health Initiative. New York State Office for Aging, like the programs that we're speaking about here are for non-Medicaid to help people not go on Medicaid, to help them maintain their, their lifestyle within their home financially. Without having to draw down Medicaid system.
So my point of bringing up the motion is that, is there opportunity to make more changes if you want to approve it as is?
I would like to make more changes because I most certainly would like to have more time and add in the demographic information.
So we're approving the notion of doing this, and then you probably will show us another version of it.
I can. Would you like me to send it through email to?
Well,
I don't think so.
I think, given Sue brought up something, that maybe others said it as well, so
Okay,
as long as it doesn't delay. Okay,
sure.
right.
Thank you.
So the motion is, made and seconded. All those in favor?
Aye.
Opposed?
Thank you. I appreciate being able to do this initiative, so. I do have an additional item that's not on the agenda today. I'm excited to share with everyone that we were invited by the Argyle Central School District to engage in a partnership to promote the senior dinner theater event. We'll be hosting an intergenerational dinner theater event for individuals age 60 and older. The school's drama club will be performing Disney's High School Musical Junior. Our office will be providing the delicious dinner to include dessert, and the student council at Argyle School will be serving our guests and also waiting on the tables and addressing the needs of the dining room. So at this time, we haven't, this has been on pause since before COVID, so we're very excited to reengage in this. And I'm sharing a flyer with you today and with the request that if you could also help support us by posting it on your Facebook page or website or help promote by attaching the flyer and local venues, we would appreciate it. So the tickets have to be purchased, we say purchased, or we're suggesting the contribution be received in advance, so we know before the event, how many meals and how to make the arrangements in the school itself. Tickets can be obtained through our office.
Thank you, Gina.
Thank you. Flyers. Have a good day.
Next we have youth girls.
Morning. I realized that yesterday at Public Safety, I neglected to actually introduce myself to the people. Sue Mori, I've worked for the agency for roughly 26 years. But I recently, 8 months ago, when Mike selfishly retired, I became director of the agency. So I'm relatively new somewhat to this process. So I have a few things on the agenda. One of which is to recognize the rollover funds for our Rural Communities of Practice grant, which is one of the 2 bi-county collaboration grants that we have with Warren County Probation. And the dollar amount that we would be rolling over is $48,783.72.
This goes to finances. Yeah, so much. Yes, okay, second. All those in favor? Aye. Opposed? Motion passes.
Thank you. And then in relation to the Rural Communities of Practice grant, I'd like permission to purchase incentives for the dollar amount of, which is in the form of gift cards, like Dunkin' Donuts or McDonald's, or that type of gift cards, of $3,750. And these are gift cards that we use with both our JCR program, which serves high-risk youth, and our pre-pins, actually really any program that uses a behavior modification system of rewards and sanctions. And we use these as incentives. And they have been, as silly as it is, a $10 gift card will allow kids, give them motivation enough to make it to 5 days of school. Like, so it's as simple as that. We use them for behavior modification, and then our pre-pins program, which is through the SCSJP, we use it to encourage kids to be in school. And then on the side note, we also have some of them through this grant that we buy stewards cards, and we use them like at the parks when we do pop-up events, or some of the rec programs, we do pop-up fun events, so we can use them as some giveaways to encourage positive youth development. So it would be the incentives of $3,750. And then we have youth enrichment activities that we purchase. These are really specific to those high-risk kids. And it's Warren County youth and Washington County kids. And we bring them to activities or anything that could charge a fee. And that would be 4 $500 Visa cards. Now, with both the incentives and the youth enrichments, we have a system in which the dollar amounts, the cards given out are retract, so that we know what we're using those cards for. So I would like permission to purchase the incentives and purchase the youth enrichment cards.
This would be a motion to approve and move to finance.
I think I have to move to approve it. She's already budgeted.
Right, yes, we already have it in the budget.
Second. All those in favor?
Aye.
And then, I'm sorry. And then the educational modules, I'm going to take off the plate for today because I was hopeful that I would have the 2 additional quotes that I need for that, but I do not have those, so I'll table that until February if that's okay with everyone. If we can have that discussion. Thank you. On a positive note, we have 2 people to appoint to the Youth Advisory Board. One is a youth, Abby Reed from Fort Ann, she's Fort Ann youth, and then Kathy Sweet, who does the parenting classes for Cornell Cooperative Extension. Will fill a spot for youth development program stakeholder on our board. And unfortunately, she really is kind of taking the place of Chris Nestle, who will no longer be on our board. I'd like approval to appoint these 2 to the youth board.
Motion approved. Take a second. All those in favor?
Aye.
Aye, opposed, motion passes.
Thank you. And then finally, we just have Warren County wants to contract with us again for the coming year for differential response with a contract fee of $5,000. And differential response is the raising of the lower age of juvenile delinquency. So any youth who theoretically commits what would have been considered a crime, but they're under the age of 12, can no longer go into the youth system of probation or any of those things. So, but they still have to provide services, differential response services, so they contract with us. Last year, we had 5 referrals, but 3 youth, so 1 youth had multiple referrals. And 2 of them we were able to do a lot of work with, but the 3rd, it's not as super time consuming as it is now. If the numbers were, extensively high, we would have probably thought about a different price amount, but it's 5 youth for $5,000. So we would need permission to contract.
I think it's just basically, Board of Finance and authorize the chairman to sign the contract.
Okay,
Motion to move the finance.
second. All those in favor?
Aye.
Opposed. Okay, motion passes.
Thank you. I think that's all I have, except for the reminder that we do have Winter Fest, which is really Spring Fest, this Saturday from 10 to 2 at Lake Lauderdale. We will not have ice. So all things ice are eliminated, but we will have games and we'll make the best of it.
Thank you, Sue.
Thank you.
Okay, community services, mental health, Rob.
I'm Rob York, Director of Community Services. Been in my position this year, will be 22nd year as Director of Community Services. I just have a few items this morning. And in fact, my first item, I believe I do not need to do because of checking the budget and we already have those funds in the 24 budget. 263.5 is already in the 24 budget. So I'm going to move my second item, which is a request to amend the 2024 Washington County budget to allow for acceptance of $191,512 of opioid regional abatement funds.
So the amendment, what's the amendment?
So the amendment is to bring new funding into this. The 263.5 that I have in my budget right now is funding that rolled over from last year.
Okay,
But this is 2024 funding now that they're adding, so that'll give us a larger pool. And our plan is to go out to some sort of a solicitation of proposals, working with Barb and purchasing what that process will look like. But this is just to line up the funding in the budget.
okay. Motion to Sam, second me. All those in favor?
Aye.
Opposed?
I also had a 2023 psychiatric expense report, so hopefully you have that in your packet. I like to just report on this each year, 3 times throughout the year, just to keep the committee posted because these expenses can be so variable. This year, Washington County budgeted $250,000 for this line. So we did come in under budget this year. That was good news, but this shows you just quarterly through the year, the expenses that were incurred. When I say New York State chargebacks, these are bills that we receive for individuals who are supported by a court for competency examinations. Yeah. And if they fail, if they have felony level and they fail the competency examination, then they go to a state facility to go through a curriculum of restoration. And the chargebacks, the per diem chargebacks are listed there. So it's over $1,000 a day at each facility. So the lengths of stay can really vary. Generally, I would say probably 60 to 90 days is a typical restoration period. I was looking back and let's see, last year there were only 3 individuals, but the total cost was $578,000 for the county. And one of those individuals had been in for 10 months throughout the year, 22. So when you get people that are in there for longer periods of time, or you get multiple people in there, it adds up very quickly. In 2021, the costs were 180. In 2023, the cost here of 172, that represents 4 individuals. One was in for 51 days, one was in for 24 days, but that was the person who had been in 10 months prior year. So those were 24 days in January. 63 days for the 3rd person, 18 days for the 4th person, although those were the last 18 days of 2023 in December. And so that individual is still there. So we're incurring expenses for that individual as we speak.
So Rob, it appears that these numbers can vary widely.
Yeah, they vary widely. And in fact, I just jotted down that Warren County, looking at their 23 numbers, they're getting hit very hard. Last year, 9 individuals and $845,000. So that's the highest expense ever for either county. So yes, very well.
I know that each one is a different, but is there a point in time when they say, hey, this program's not working, so we're going to try to do something else? Or just, you know, something's gonna keep them out of incarceration?
Well, sort of the option at that point, if it isn't in terms of somebody's unrestorable, there is a process you can go through. It's called Jackson hearing, and you file a petition. You file a petition for a Jackson hearing, and we can get the person released and committed civilly.
I only asked that question because I wanted to have it, I wanted something. I mean, that's, you know, it's $1,000 a day, that's almost 2 years. At what point in time is an evaluation to say, hey, this isn't helping the individual? Or it is helping him or restore?
Well, then keep in mind, the restoration is not to get back to mental health. It's, are they then competent to assist in that defense?
Well, that's my point.
Yeah, it's a constitutional issue, being able to assist in your defense.
Typically, the ones that we will run into, if you determine that somebody's not restorable, it would be somebody like with a developmental disability, and they just don't have the capacity to ever be restored.
Gotcha, okay. Just curious.
Thank you, Rob.
Go ahead. One other thing, generally, there are new committee members. I offer, you know, to kind of do an overview of our office. We're kind of unique in the sense we're a shared administrative office between Warren and Washington counties. And we don't operate any direct county services, we contract out for services. We're both with community services board, it's also part of local government. So I'd like to offer to do an overview, and I would ask the committee for preference to do it during committee, or I'd be willing to, just set up something separate for those that are interested. Any thoughts? Preference?
You know,
I would prefer to see so. That opportunity or what, yeah. Just me. Yeah. That's a different issue. I don't think it'll happen.
You'll make sure of that.
So what I'll do is I'll reach out to the new supervisors, or just make the whole committee aware of the date, I guess, and,
Sure.
anybody that else is interested.
Sounds good.
Sound good?
Yep.
Thanks,
Thank you.
Rob.
Okay, Washington County EOC week, Shelley.
Let's make sure I get this chair. So for new committee members, my name is Shelley Smith. I am the Executive Director of LEAP, which is actually Washington County Economic Opportunity Council, doing business as LEAP, Learning, Employment Assistance and Learning, Employment Assistance and Partnership. We are an independent nonprofit in Washington County. We're not county employees, and I report to this committee as part of our collaborative relationship because of several contracts that we have. And also as one of them has to do with the Saratoga Warren Washington Workforce Development Board. With the Saratoga Warren Washington Workforce Development Board, the contract is for the WIOA grant, which I'm about to discuss, is through the county, and the county passes through that money to LEAP to operate the Career Center for the Workforce Development Board in Washington County. So for those reasons, that's why I report here to you, and you'll be hearing from me quarterly on our contractual obligations, our food pantry, transportation, and buildings and grounds contracts as well, just to update you on where we are on expenditures and use of those funds that we contract with. Today I'm coming to you I'm looking for a resolution to authorize the recertification of the Saratoga Warren Washington Workforce Development Board. This is under the WIOA Act, or Workforce Innovation and Opportunity Act. It's also subject to concurring resolutions by the boards of supervisors of the counties of Saratoga and Warren. Sorry, on my notes here. So the Workforce Development Board is a system. It's comprised of representatives appointed by each of the boards of supervisors in several different sectors: business, education, economic and community-based organizations, youth organizations, labor organizations, vocational rehabilitation, and New York State Department of Labor. The system provides funding to 3 career centers, one in each county, to provide career development services to adults, dislocated workers, and youth, both in school and out of school youth, till the age of 24. That funding, which was over $2 million in program year 2022, is vital in providing assessment, career development training, and wraparound services to over 365,000 Saratoga Warren Washington County residents. There are compliance responsibilities with this funding. In order to continue to receive this WIOA funding and have this collaboration, the compliance elements are board composition. There are certain percentages for each of the above named components. Business, I believe, has to be at least 51% of the board represented on that. Also, satisfactory performance. You can get performance reviews, sustained fiscal integrity, and the last is the current chief elected officials agreement. And that's what I'm coming to to you with today. Right now, the Saratoga Warren Washington Workforce Development Board satisfies all of those elements for recertification except for the chief elected official agreement. The most recent agreement was signed in 2020. It's supposed to be done every 2 years. So a new agreement is required to maintain this. So this same request has gone out to Warren County and to Saratoga County alike. Do I have? I sent along a copy of the letter, but I didn't bring that with me, but it has the letter, I'm sorry, I do. This is the multi-jurisdictional chief elected officials agreement, and it requires signature of the chairman of the board of supervisors from each county. So that is what I'm asking for today is simply just a resolution that this will go before the board of supervisors for the chair to sign that multi-jurisdictional agreement and continue operating as part of the Saratoga Warren Washington Workforce Development Board and that system.
Okay, do we have a motion to move this to the full board of supervisors? Okay, all those in favor? Aye. Opposed? Passes.
Thank you. I
Thank
have
you.
one other quick thing that was not on the agenda. I discussed with Melissa this week. Leap has as I mentioned, we have several contracts with the county. One of them is for our food pantry. We've been receiving funding from Washington County for the operation of our food pantry. And that particular contract, along with a couple of others, had not been revisited in a long time. That one was 2007 was the last time it was revisited. So we were looking at contracts over the summer, and short version is what we have requested is an increase of $20,000 to that food pantry contract. As I said, we are not county employees, so I remind you of that to help you understand that I am learning this county process. I don't really know it very well yet, so part of that is why I'm here at this point. Our request for that additional $20,000 in that contract did not get to the county in time for budget approval, so it would be a change to your budget. And that is why I'm here. I have a few statistics for you just to support that request. I have overall, and I believe this, you have received this as well, but our food pantry in 2022 served 1,721 individuals or households. In 2023, it was 2,744. That's an increase of 59%, an increase of over 1,000 individuals or households in 1 year. We also, our food pantry allows Department of Social Services access, so that when we are not, our pantry isn't open or isn't staffed. If someone is immediately in need of food, doesn't have time to wait for a referral, they county employees can get into that pantry and get the food they needed. That usage increased from accessing for 24 households or individuals in 2022 to 119 in 2023. A large part of this is due to the increase in unhoused individuals in the county. It's been, as we've talked about so many times, such an epidemic, and what we have to keep on hand for unhoused individuals is not available through our grants or the regional food bank, and is more pricey than other things that we would get for a household that had a full operating kitchen and that sort of thing. We need to buy shelf-stable foods that can be microwaved. It's for people that are in hotels or one-room places like that. So those shelf-stable foods and items for the specifically for the unhoused cost just under $2,300 in 2023. We made 53 emergency food deliveries, and we served this year there were 170 new households or individuals that we had not served the previous year. So 100 new households served by the Leap Food Pantry. So that's it.
So that would be a motion to refer to finance.
Yes.
Sam, Second, Nate, all those in favor?
Aye.
Aye, opposed? Motion carries.
Thank you very much for your time.
Thank you, Stu. Any other business? Motion to adjourn. David, second, Sam. All those in favor?
Aye.
We're adjourned. Thank you.